All right, this is Brian Johnson from Finance and Commerce, and I'm pleased to be joined by Dr. Cyrus Batheja, the new President and Chief Executive Officer of Ecumen, one of the largest local providers of affordable housing for older adults. A registered nurse and nationally recognized healthcare leader, Batheja brings more than 2 decades of experience advancing care models that integrate healthcare, housing, and community services for vulnerable populations. Batheja succeeds outgoing President and CEO Shelley Kendrick, who joined Ecumen in 2012 and assumed the CEO role in 2019 after serving as Ecumen's Chief Operating Officer. In September 2025, she announced her retirement from Ecumen. So, Cyrus, thank you for joining me today. How are you doing?
I'm doing really well, Brian. Thanks for having me. I'm so excited to be able to take part in this activity.
Absolutely. Well, before we start talking about your new role, can you tell us a little bit more about Ecumen and its mission?
Sure. Ecumen is one of the oldest providers of senior care in the country, really focused on four key areas, Brian. First being um, support for seniors from a clinical standpoint. We provide skilled nursing facilities, assisted livings, and memory care. We also provide market rate housing for older adults in a variety of different places around Minnesota. Um, we have an affordable housing portfolio that we've been developing and are really focused on. And then we have home and community-based services. So I have the opportunity to serve individuals in their own homes and within the community. And so it's a little bit about our offerings. Ecumen has a legacy of providing first class nursing care and other health services to individuals. And that's one of the things I think is really most exciting about my time and my joining.
And I understand you just started your new role this week. Is that right?
So I did, Brian. Yesterday was my first day, so I'm jumping in and learning a lot.
Great. What attracted you to this opportunity?
Yeah, I think there's really three things that come to mind that attracted me. So one, Ecumen's focus on creating uh, impact on individuals, particularly older adults, creating really first class healthcare outcomes for individuals. I was attracted by that and knowing that there's a real need within senior care around the country. Um, it seemed like it was a wonderful place to be able to do my life's best work. Secondly, I'm a nurse by trade, and I'm happy to tell you a little bit more about that as well. But Ecumen has a large workforce of nurses, and the team at Ecumen, the people, was a huge attraction for me to join the organization. Importantly, a lot of my work in the past, Brian, has been focused on leading teams and serving patients around the country. And this was right here in my own home, in the community that raised me up. And so really felt like having that opportunity to spend time with the people and being able to be present is something that was a real attraction for me as well. So, I would say it was, the clinical impact that Ecumen's making, the people and the team, and the proximity. Those are the three big items for me, Brian, that I really felt like the time was perfect for this.
Well, you mentioned your background in nursing. I wonder if you could just tell us a little bit more about that background in healthcare and senior living and how it prepared you for your current role.
Yeah, well, I had a pretty interesting way of finding my way into nursing. So maybe I back up a little bit and tell you a little bit about that. So I come from a history of nurses within my family. My mother was a registered nurse, and she became a nurse in her mid 40s, Brian. And so I had the opportunity to watch her go to nursing school. She went to a place called Normandale Community College in Bloomington, Minnesota, and I'd accompany her to her classes when she went. So spent a lot of time in lecture halls, biology labs, student center, library. Really got to appreciate academia through that opportunity, but particularly watched her enter nursing and really flourish as she had the opportunity to do that. So when I had the chance to pick a career, I went through about a semester, and it was really clear to me. I was at Normandale, and I'm kind of here in my early 20s. Just before that, I chose a path in nursing and ended up with a 2-year degree in nursing, an associate degree, Brian. And I'm sure we'll have a chance to talk about this as we go through the interview. But I found my way to a nursing home as part of that, and had some really interesting experiences in the nursing home as I went through. I continued on in my academic pursuits and ended up going on to get a bachelor's degree in science nursing from Augsburg University, and did work in public health. So I'm a licensed public health nurse as well as a registered nurse in the state of Minnesota, really focusing in on populations within the Phillips neighborhood of Minneapolis, working a lot with the Native communities there. It was eye-opening for me. Really had an opportunity to understand how dynamic nursing can be. It's not just about working in a nursing home, and there's just all kinds of opportunities for nursing. And so spent a good amount of time working on public health initiatives. And then I went on and ended up doing an MBA and did my doctorate at the University of St. Thomas, and learning about organizational development, leadership, and social movement construction. And as part of that, had the opportunity to use those skills in a variety of different ways, particularly when I was with United Health Group, leading quality for them for a period, particularly local and community-based programming to improve quality, learning a lot about populations and their needs. Everything from the Hasidic Jewish population in Brooklyn to the Navajo Nation in New Mexico, and across. And you really start to understand the power of nursing and the need for good clinical models. And again, I hope we have a chance to talk a little bit about my vision at Ecumen, because these things will tie into that.
Mm-hmm. Yeah.
And yeah, go ahead.
Yeah, please tell us more about your vision for Ecumen and what's on your plate.
Well, there's a lot on my plate, Brian, and it's all exciting stuff. So, my vision for Ecumen is to really be the leader of senior care and senior housing in the country. And, we do this in partnership with others, really taking on a collaborative approach to community. And a lot of my past work was about those sorts of collaborations, understanding the needs, wants, and desires of the community, and then aligning, our capabilities and the capabilities of the community, being able to identify where there's gaps and being able to, provide support in filling those gaps. Really being a leader in the sense of contribution to healthcare in ways beyond what's traditional. So thinking about best in class approaches across the country, and even internationally, and giving our teams the ability to be able to do their life's best work. I feel like when we empower our teams and they're able to focus on the people, that's the biggest gift we can give in healthcare. It's the gift of time. It's just so limited, and so I think that's really where my focus is at, is on our team, on the people we serve, on the communities, on the profession of nursing as a whole.
Yeah, and tell us a little more about that nexus between healthcare and housing for older adults and how Ecumen addresses that.
Yeah, well, it's one of those things that is, I think, underrepresented in a lot of ways. Housing is health, and when people have a place where they feel like they fit, they have purpose. It makes a huge difference in their health outcomes, and that's really proven. And so, at Ecumen, we're focused on making sure that these things are not mutually exclusive, but rather aligned. Making sure that people live in communities that, first and foremost, they feel safe and they feel like they're able to get the best possible care. But as well, they have purpose in that community. They have relationships, they have activities and engagements that are meaningful to them, that they feel like they're active participants. And a big part of what I've been focusing on, Brian, since really learning about the role and now taking a step in, is listening. How do we listen better to our community? How do we listen better to our teams? How do we listen better to residents and families? And Ecumen is really focusing in on that. And that's a big part of bridging that nexus that you talked about, of creating living environments that are aligned to, what people expect. And that's not what we expect, but it's more so an activity of listening and then executing based on that.
Well, I know I've been impressed with the work that Ecumen has done in the affordable housing sector for seniors, and there was I know Ecumen received a Finance and Commerce Top Project Award just in 2023 for an affordable housing development on Snelling Avenue in Minneapolis. Do you care to highlight any current projects that Ecumen is working on? I know you're still new on the job, but anything you'd care to highlight?
I am new, and it's one of those opportunities of learning, and I'm going through that. But I'll say I've been really impressed by our approach to memory care, and being able to contribute from a research perspective on understandings of best in class approaches related to memory care. Our hospice teams, our hospice and home care teams, our home and community based care teams are doing some phenomenal things, really, I'll say innovating in the ways in which we take care of people, and providing comfort to them and their families. And again, thinking about collaborations with community partners, where folks may already be receiving supports. How do we align with them to really take an interdisciplinary and a team approach to care, especially as people are in need of, uh, fragile and critical matters to them and their families as well.
Well, from a big picture standpoint, as we all know, everything's getting more expensive these days, and senior housing is no exception. What are some of the opportunities and challenges you see out there when it comes to providing affordable housing for seniors?
Well, I'll say, there's a lot of challenges when it comes to providing affordable housing. Just being able to find space for all of the individuals who need it. I would say is one of the biggest challenges, and just keeping up with that. Things are becoming more expensive every day, and keeping pace with that and understanding the needs of the community, making sure that we're aligning to those needs is a huge opportunity to match that challenge. So, I'm an optimist by nature, Brian, and I really think about these things from that perspective. Being able to have the caregivers that are needed in the housing. It's a demographic that's growing, the needs are increasing, and the caregiving workforce is not keeping up. So, being able to contribute, again, opportunity here, being able to contribute to that, thinking about collaborations and partnerships with academic institutions to allow their students to have firsthand experience, being in our communities, spending time with our seniors and others, their families, is a really interesting and great opportunity that we have at Ecumen. I think as well, one of the other challenges that kind of comes to mind is the balance of tech and human touch, and thinking about how do we do that in a way that makes the most sense. From an opportunity standpoint, there's a lot of efficiencies that can be created, and we can help with even creating avenues for affordability for individuals, understanding our population through data analytics and reporting and advanced techniques. But at the same time, and I'll say also, robotics is something to consider, because that is coming together rather quickly. But at the same time, how do we balance the human touch, the compassion that's needed in this work? Especially when you think about things like hospice and end of life care. These are not things that would be best handled, in my opinion, by AI and robotics, but rather having a caregiver who understands, my unique needs, the needs of my family, my culture and background, and then making sure that they're able to do their best work that's enabled by things like AI and potentially robotics. So it's that balancing act. It's a challenge and an opportunity all wrapped into one.
Well said. Is there anything else you'd care to touch on, Cyrus, before I let you go? We covered a lot of ground there, and it's been an interesting conversation, but I wanted to give you a chance to get the last word in here before I let you go.
Well, I just want to say, Brian, thanks again for giving me this opportunity. I'm really excited to have the chance to lead such a wonderful organization as Ecumen, and to be able to serve this population that's so close to me. The trust is the main thing, and I'm excited to be able to support these folks and live up to the trust that's been put in me. And so, that would be my final word for today. Is that healthcare is a game of trust, housing is a game of trust, and I'm really excited to step up and sit at that high stakes table, and prove out how folks can trust us here at Ecumen.
Well, thank you for your time, sir. Good luck in your new role, and I hope we can stay in touch and talk again soon.
I'd love that, Brian. Have a good rest of your day.
Thank you. You too.